Well, hello again, everybody. Today is Wednesday, January 27th. Welcome into another Keep Boone Healthy Facebook post. This is David Jackson, President and CEO of the Boone Area Chamber of Commerce. Thanks for joining us here as we catch up with Dr. Scott Elliott, Superintendent of Watauga County Schools, as we do from time to time. And again, Dr. Elliott, thanks for your time as always. And it has been a little bit since we have talked to you last about the operation of Watauga County Schools. And with so much information coming out of the governor's office today, thought it'd be a great time to just kind of ask you where things stand from an operational standpoint with the school system, and also talk about an important survey that's come out here recently to parents as well. So first of all, welcome. Happy New Year. Happy 2021. And thanks for being with us here tonight.
Thank you, David. Good evening. Always good to be with you.
So let's talk about the survey element first. I know there's some timeliness to that. It's never too early to think about operations moving forward. And while we're working in today's landscape, you got to think about tomorrow a little bit too. So with that said, what is the mindset behind putting this survey out and trying to get some of that data now?
Great, very timely question. Thank you. Today we sent out a press release and posted on our website a survey that is open to all parents in the county, those who are enrolled in the current Watauga Virtual Academy, our online school. And we especially want to reach out to those families who currently aren't enrolled in our school system. Maybe they were, maybe they've gone to homeschool temporarily during COVID, or maybe they came to us for our virtual academy from homeschool because they saw that as a good option. What we're trying to determine is what is the level of interest and need in a permanent Watauga Virtual Academy moving forward, meaning not in response to COVID, we're not thinking that or hoping that we will be in this mode of operation next year. But we are thinking about, is there an appropriate role for an online virtual education program or school for students in the community moving forward? We've learned a lot in the last 10, 11 months about remote instruction. We've had some teachers and some students who have thoroughly excelled at it, others who have struggled for sure, and who need and prefer a face-to-face instructional setting. But the ability for students to be able to learn synchronously, sometimes asynchronously, to have the flexibility to perhaps travel, or those who have other ongoing chronic health conditions and may need flexibility around their schooling, we think that we've learned how to make this work. We simply need to know how to plan for it. So it's we're nearing the end of January, and as the normal cycle of school goes, this time of year, we're planning for next year. We're developing our budget that will go to the county commissioners in the next few weeks. We're developing a plan for our staffing in terms of how many teachers are we going to need, who might be retiring, who might be leaving for other employment or things like that. And certainly knowing how many students might be enrolled in our virtual academy will help us to determine what kind of staffing it would look like, what kind of organization it would take, and how to plan for it. So we ask parents to go online there, spread the word with other parents, and just kind of let us know what you're thinking. Let us know, what school community you live in, how many children, might be interested in enrolling, and what kind of grade level. If you have questions, feel free to give us a call at my office, or to your local, school, and speak to the principal there. We're going to have this survey open for just a short period of time, about a week, so that we can capture that information and begin to make some of those decisions moving forward. It's really exciting, and it's something that we probably would not have done if it weren't for these experiences with COVID. The survey is going to help us to know how to plan.
I think that's an interesting point you brought up. We have talked about this at a number of different businesses across all kinds of scales in our community about what will you learn from COVID, at the end of all of this adventure. With that said, is this a direct result of being able to think about technology, think about needs of students, and putting this kind of thought process forward versus maybe coming to this kind of setup another way?
Well, absolutely. And just like any business, and in a way, I sometimes don't want to refer to our schools as businesses, but if you think about operationally and how we adjust to the changes and the needs that our community and our students and families have over time, we have to change. We have to continue to evolve to figure out how do we best reach our children. Now, I'm very proud of our public schools, and I think that we have a lot to offer, but we have to realize that families have lots of choices, families have lots of options, and families have lots of needs. And you and I both know that folks in the community or lives have changed in terms of being able to work from home, work remotely, travel, things like that. So we just want to be able to offer a good quality choice for those families who are looking for something or need something other than a traditional face-to-face, 8 to 4, brick and mortar education. We talk a lot about anytime, anywhere education. And certainly those options are out there. Often they're for a cost or for a fee. And we think it's something that we can do. And it's important to say, to allow children who participate in those activities to have the benefits of public school enrollment. We're sometimes asked, can homeschool children participate in athletics? Can homeschool children participate in our ROTC program? Or can homeschool children be on the tennis team or in the drama club or something like that? And previously the answer was no. You need to come and be a part of our school and our school community, and that's sort of the model we've operated under for so many years. But this gives those families an opportunity to be enrolled with us, to receive a free education from us, and also to benefit from those other extracurricular and athletic opportunities that sometimes help to make a well-rounded education for our kids.
So let's talk a little bit about the current operations of what we've got right now. And certainly you got the new semester started back at the beginning of January, dodged a few snowstorms here and there in between. But overall, what is different? What is the same about the way that you are operating Watauga County schools right now versus what was going on back before the holidays?
Yeah, with the flexibility in our calendar that the legislature gave us this year and with remote instruction on snow days, we were really well positioned to be able to end that first semester for our high school students before the Christmas break. And just the timing of a couple of weather events meant that we had to push our exam schedule into January, but we've made that transition to the second semester. We're continuing on our Plan B, our 2x3 model. We do have some students in our severe and profound self-contained disabilities program that are coming every day. Our pre-K children, for the most part, are coming every day, and we have some school-based mental health programs for children, and they're coming every day. The others are coming 2 days a week in person, 3 days a week remotely. That's the Plan B model that we are allowed to operate under. We've been there since October, and it looks like we're going to be there at least for a little while longer. The Board of Education is probably going to take up this question at their January the 8th Board of Education meeting. I don't anticipate that they will be making any decisions at that time, but we'll probably have a regular update on what is happening in the community. You've heard me say for some time that I'm eager to return our students to full-time face-to-face instruction as soon as possible, but that has proven to be far more difficult than even I anticipated back in October or November, with a couple of factors. One is just the ups and downs of community spread that we have seen through the holidays. We saw it after Thanksgiving. We saw it between Christmas and New Year's, and we're only just in the last week beginning to sort of see community metrics leveling off and beginning to come down just a little bit, which we're grateful for. Unfortunately, we continue to see an increase in spread among school-aged children, pre-K children, kindergarten, all the way up through high school, who are contracting the virus through community spread, through activities and events outside of school or in their homes. We also continue to be greatly challenged operationally in terms of having the adequate staff that we need just to keep the school doors open right now. There hasn't been a day probably that I can remember, but at least since December, when we had enough substitute teachers to cover all of the classes. In every single one of our schools, our teacher assistants, who are normally there in our kindergarten and first grade classes, are teaching middle school classes, or sometimes filling in PE, or filling in for those teachers who are in isolation or quarantine because of a close contact or because they're sick themselves. So on the one hand, we know a lot more right now than we did back in August about how this virus behaves and the susceptibility, especially of young children or older children, to that virus. And there's some really encouraging signs there. We heard a report from the CDC this week that was based in part on some research from Duke University Pediatrics. You heard it mentioned in the governor's press conference today. So we feel more confident about being able to control or to minimize or prevent the spread among children, while at the same time continuing to struggle to have enough adults to keep school open. That's a long way of saying staying in the Plan B for right now. We are very optimistic about the vaccine and the decline of community numbers. That also needs to continue to occur to safely continuing to open school.
That kind of leads into my last question for you, and I know that the governor and Secretary Cohen also hinted at this today about that eventual move into the next phase of the vaccine, and that of course would include frontline workers. That has included not only school teachers but support staff at all levels of education in our community, and we know that could potentially be a huge piece of our workforce that could get kind of allocated to that group. So with that said, what are you all doing from the school system's perspective to make sure that you can assist with that process to expedite school teachers being able to get vaccine when it becomes appropriate for them to do so in terms of the state's guidance?
Great question, David, and it can't happen soon enough for all the reasons we've just discussed already in terms of bringing some normalcy and safety back to school. I'm very proud of our teachers. I just want to say that I could not be more proud of them for what they are doing, showing up every day, teaching our students, even in this blended model. You hear lots of stories from across North Carolina of school systems that continue to be closed to in-person instruction for students, and then other school systems all across the state. While I want to be moving forward with bringing students back more than just the 2 days a week, it is because of the dedication and to some extent the risks that our teachers have taken in showing up every day to work. And I'm just grateful for them and proud of them, and we need to do everything that we possibly can to protect them. It's not just our role in helping them as we have about 700 employees, so we're one of the largest employers. But as you've mentioned before, and the guests you've had on the program before, we're doing everything that we can to help spread the word among parents and grandparents about the availability of the vaccine, how to sign up and get on the waiting list with App Healthcare, and even our role in helping to facilitate the large community event that we had just a couple of weeks ago at Watauga High School. We're ready to have vaccination events for our staff members. I appreciate Jen Green and App Healthcare for prioritizing public school employees and teachers among the frontline employees that will be in the third phase, the next phase of vaccine that comes out. And the health department is ready to go. We are ready to go. We have our employees signed up. I think as of this evening, I have about 640 of our 700 employees who have signed up for the vaccine. That's just incredible. And we're ready to schedule the event. In fact, we've tentatively scheduled vaccination events for our employees. We're not announcing that until we know that we're going to get the vaccine. And as you've heard in the news and from the governor today, that really is the holdup. That North Carolina needs to get more of the vaccine, and more. North Carolina needs to, in my opinion, prioritize public school teachers and employees at the front of the line right now in getting those shots and making it safer for our staff to be in school and for us to bring more students back to school.
Well, I know I echo the sentiments of the community when I say this. Thank you for not only your work, but the work of your entire staff from the central office on down to the individual schools themselves, and not only for the work that is going on to make school as meaningful of a situation as it always is, but for the great things that are going on in the classroom as well. We just saw a report, I believe, in the Watauga Democrat about school students in 5th grade at Parkway connecting with a classroom in Tanzania through a partnership with Wine to Water, and to understand that those types of learning experiences are still going on in the classroom on a daily basis, I think makes people feel great about the quality school system that we've got here in this community, and everything that you are doing to try to keep that as functional as possible right now. I can only imagine that when all this stress of COVID is free, the full head of hair that you've got is going to be amazing. But I know it's been a trying time for you, so I do appreciate it, and I know our community does as well.
I appreciate that. I just want to say, as I always do, to our parents, how much we appreciate them, how we do not take for granted the difficulty that this entire situation creates, and our love for these children and these students, and our desire to get them back in school as much as possible, as soon as possible. Thank you and our business community and everyone for your ongoing support. It means a lot.
Thank you.